modern living leads to a hidden epidemic of neurological disease. Yes. Admit it. Your present artificial life is varied degree of neurosis. A wise and peaceful world cannot never emerge from modern Western lifestyle. Western countries appear to be affected by a hidden epidemic of neurological disease, and it is not just aging that is to blame. Environmental factors must play a major part, such is the increase in these diseases. A study published in the journal Surgical Neurology International in the USA, compared 21 Western countries between 1989 and 2010 and found that dementias are starting a decade earlier than they used to be in the past. Deaths caused by neurological disease have risen significantly in adults aged 55 to 74, and for adults 75 plus the rate has virtually doubled in every Western country in just the last 20 years. The rate of death from neurological conditions has practically doubled in every Western country over the last 2 decades. More elderly women are dying brain disease than cancer. There is a remarkable increase in motor neurone disease in the UK, as well as the earlier dementias. The study finds that diseases such as Alzheimer's are now being regularly diagnosed in people in their late 40s. Young dementia, in their late 40s and early 50s, is something unthinkable higher than 20 years ago, and dementia is killing more people in the modern world. There are more effective treatments for cancer and heart disease, with advances in medicine making such physical illnesses easier to treat, whilst there have been less advances in the treatment of neurological conditions. Professor Colin Pritchard of Bournemouth University led the study said, "It is not just because people are living longer to get diseases they previously would not have lived long enough to develop, but older people are developing neurological disease more than ever before. The rate of increase in such a short time suggests a silent or even a hidden epidemic, in which environmental factors must play a major part, not just aging. Modern living produces multi-interactional environmental pollution, but the changes in human morbidity, including neurological disease, is remarkable and points to environmental influences. Environmental changes over the last 20 years have resulted in much more air transport, motor vehicles, insecticides and electromagnetic fields, which can be generated by sources ranging from X-rays to electricity pylons. There have been major environmental changes, including increased population, economic activity, substantial rises in road and air travel, increased home technology involving background electromagnetic fields from mobile phones, microwave ovens and computers. These are unique to modern time, and these possible environmental factors cannot be ignored, especially as they probably interact. Tremendous hike in air transport, quadrupling of motor vehicles, high usage of insecticides and rises in background electromagnetic field, and so on kills the neurons of brain. Cigarette smoke contains more than 7,000 chemicals, 70 of which are known to cause cancer. A long-running U.S. study on the effects of radio wave radiation emitted by mobile phones has found clear evidence of high levels of exposure and heart cancers, and evidence of links to brain and adrenal gland tumors was also found. Study also focused on 2G and 3G wireless signals, but researchers say their findings are still relevant as most mobile phones still use these bands alongside Wi-Fi and 4G. This list of possible features might be described as modern living, and the USA is the epitome of modern living. When America sneezes, other countries get cold a decade later. We will compare the disease of rich and poor. The parasitic diseases like cysticercosis, hydatid cyst of brain and infective diseases are dominant in poor people. Brain abscess because of chronic suppurative otitis media, cyanotic heart disease-associated brain abscesses are common among poor. Tubercular meningitis, tuberculoma are also diseases of deprived sector. Brain trauma also happens commonly to active young people who own two-wheelers, walk on the road, cross on the road, fall from height like after climbing trees. Again, these fall in low socioeconomic group. The rich people own better cars with airbags or fly and use high-end trains where accident rate is less, and they fly also, which is the safest mode of transport. Gliomas are the tumors which can happen to all, and meninomas plus acoustic tumors also occur to both groups. Diabetes, hypertension, obesity, atherosclerosis, myocardial ischemia are diseases of rich. Joint problems are also more common to rich people, and so are strokes. Talk so much about smokers getting cancer, lung, stroke and heart attack. How much relief to anxiety and depression it brings. After a prolonged surgery, cigar smoking of Dunhill or Rothman cigarettes look like rewards of your hard work. So is the small amount of whiskey, more so if it is Scotch. These results will not be welcome news, as there are many with short-term vested interests that will want to ignore them. It is not that we want to stop the modern world, but rather make it safer. It is time for us to wake up and realize that a major problem we now face is unprecedented levels of neurological disease, not just the earlier dementias. Wake up, listen to our future generations, those already born and those yet to take birth. They all want us to stop gifting them breeding environment of mental and physical disorders. Thank you.